So welcome to the fourth webinar in RTI series, Learning and Adapting During COVID-19. Today we'll be discussing data for cross-national decision-making. My name is Charles Lau, and I'm your moderator for today. If you could go to the next slide, please. I'm a survey methodologist at RTI, where I lead mobile phone and face-to-face surveys in Africa, Asia, and Latin America. I think everyone on this webinar and around the world has really witnessed the rapid adoption of mobile phone surveys in developing countries during the pandemic. Because face-to-face surveys aren't feasible now, organizations that really never before thought about mobile phone surveys are now quickly adopting them. Survey vendors have quite impressively set up virtual call centers in a matter of weeks, not years. And this is really a tremendous time of learning about phone surveys in low and middle income countries. I've worked in this field since the early days, and it's truly remarkable to watch the developments around the world. And as a global research community, we've probably have learned more in the past 4 months, really, than the past 4 years. You know, this learning spans all aspects of the survey process, from sampling to questionnaire design to data collection, operations, and quality control. And there's also been learning about how to get survey data in the hands of policymakers for evidence-based decision-making. And my hope is that as a research community, we will document and share best practices from our work, because all of this learning is happening so fast. Critical to the sharing are webinars like this one, and a lot of other webinars that are happening this spring and summer and the rest of this year. And during these webinars, we're hearing sort of hot off the press insights. But to complement these webinars, you know, I also hope that we focus on methodological research that asks really hard questions, right? So questions like, how representative are mobile phone surveys? How can we adjust for bias? How valid and reliable are measurements from mobile phone surveys? My colleagues at RTI and I have been studying these issues for a few years now, and we're excited to continue this line of research for mobile phone surveys on COVID-19. So we have a really great panel of speakers today. I'm delighted to introduce them and thank them for speaking today. Next slide, please. So Roxana Elliott is the Vice President at Geopol. She has over 10 years of experience in international communications and marketing with a focus on Africa and the Middle East. And at Geopol, she manages a team who author and disseminate research reports and data. Next slide. Steve Glazerman is Chief Research and Methodology Officer at Innovations for Poverty Action. He's a labor economist who focuses on impact evaluation design, cost effectiveness analysis, with an emphasis on education. And Steve has led a number of randomized controlled trials on early grade reading interventions. He's advised on evaluation design for projects funded by the World Bank, USAID, and MCC. Next slide. Abigail Greenleaf is Associate Research Scientist at ICAP Columbia University. She currently works for ICAP's Population-Based HIV Impact Assessment, or PHIA survey. These are carried out under the leaderships of Ministries of Health, and these data are really important for benchmarking a country's progress towards controlling the AIDS epidemic for policy and program evaluation and interventions. And she's a returned Peace Corps volunteer from Cameroon. Next slide. Kristen Hemeling is a senior economist and statistician at the World Bank. She's with the East Asia and Pacific region of the Poverty Global Practice. She co-leads the Global Solution Group on welfare measurement and data innovation. And her research interests center on sampling and survey statistics, and her work has been published in top peer-reviewed journals. Next slide, please, is Shane Kahn is a survey specialist at UNICEF, and he currently oversees the development of new surveys and tools and methods that are used by UNICEF's mixed surveys, the multiple indicator cluster surveys. And his most recent work has tapped into the potential of mobile phones to collect fast and representative data in low and middle income countries. So next slide, please. So today, each speaker will give about a 6-minute lightning talk where they will address 3 questions each. So the first question is, what did they do? Just briefly, what are the survey project that they undertook? 2, what are some challenges they faced and how do they address those challenges? And 3rd is, what are some best practices to share with the research community? So we have a great group at the webinar, so we may not get to every question, but we hope to generate a really great Q&A discussion with our speakers and also through chat. So I'll moderate this Q&A session, and I welcome you to submit questions at any time. Please submit questions using the Q&A feature at the bottom of your screen, and please send questions via the Q&A, not the chat. If you have any technical issues during the webinar, you can contact us using the chat feature in your toolbar, and our RTI is Cameron Johnson will help you from there. Please note that everyone will remain muted during today's webinar, so please use the Q&A and chat features. So now it's a pleasure to welcome our first speaker, Roxana Elliott from Geopol.
Hey everyone, thanks for having me. I'm excited to get to speak to you about some of the studies that Geopol's been running. So Geopol is a mobile-based research company, and we conduct quite a few internal studies, which I oversee, as Charles mentioned. So the one I'm going to be going through, our most recent study on coronavirus, looked at the economic impact of COVID-19, specifically in sub-Saharan Africa, which is one of the key regions that we work in. So we looked at things like employment, ability to work, if income has changed, ability to pay expenses, and mobile money usage in the study. And this was conducted by SMS in Cote d'Ivoire, Kenya, Mozambique, Nigeria, and South Africa, and it was conducted in June. So just briefly looking at the results of this study, we found unsurprisingly very high economic impacts really across all countries, cutting across all job types and income levels as well. We found 60% said that they're unable to work due to coronavirus right now, and 3/4 say that their income has actually decreased since prior to the pandemic, and that's of people who were working prior to the pandemic as well. We also looked at results by job type and also informal workers, so people in selling, agriculture, transportation, versus formal workers, so people in government or working for large businesses. And we found some really interesting differences between informal and formal workers. One of them being informal workers were much more likely to report higher income losses. They're also less likely to know if they'll have a job to go back to after coronavirus, so have higher job insecurity. We also found that informal workers are more likely to say that they are relying on loans and also their savings to pay their expenses right now, versus formal workers who are more likely to say that they are still reliant on their income or salary to pay expenses. So those are some very brief highlights of that study. Going into sort of the second question around methodological or operational challenges, Geopol, we specialize in mobile-based research, so we're lucky that we have a team who sort of knows all the best practices. But that being said, there's still always things with each specific study we run that we have to overcome or think about at the beginning of the study. One major thing is the mobile survey mode that we will use, and sort of weighing the pros and cons of each mode that we have available to us. So this one we did by SMS or text message. It's a two-way text message conversation. We did that because it's quite fast, it's relatively cost effective, but we also do a lot of CADI or voice call work for other projects through local call centers as well. And so for SMS, you really need to keep the questionnaire design in mind and have to get creative with how you design the questionnaire, because it has to be quite short, around 30 questions total for this study, including demographic questions. And then each question also has a strict character limit, which includes both the question itself and the answer options have to be within that 1 character limit. So for this one, for example, for job type, which was an important question for this study, given we were looking at economic impact, instead of being able to include a long list of job types in one question, we had to split that up into 3 or 4 questions where we sort of narrowed it down to get to the more specific job type that we ended up using in the surveys. So that's just one example of how we sort of adapt to SMS when we're designing our surveys. And then another best practice, in addition to the questionnaire design, which is really very important, and definitely we recommend designing your questionnaire to the mode you'll be using, is often easier and gets better results than fully adapting, say, a face-to-face survey and trying to put it back into like an SMS or CADI questionnaire. The other one would be making sure you're keeping the local context in mind. So with coronavirus, we know different countries and even regions within each country are under different restrictions right now. Some are fully locked down, some are more open. So if you're doing a multi-country study, one question may not be relevant for every single country. So thinking about the local context in the wording of each question to make sure it really would make sense for the situation that country is in. And then also on the implementation side, we recommend using, for CADI, we use local call centers because the interviewers know best practices specific to that country that you or we might not know. So some countries, respondents are less likely to give long open-ended answers, for example. So you may want to either remove some open-ended questions from that survey or make sure the interviewers are really trained to get those high-quality open-ended answers in if that's what your study relies on. So definitely both questionnaire design and using local partners to make sure you have local context incorporated into your questionnaire and the implementation are really important. And those are my brief results and best practices. We have information on that study on Geopol's website, and the raw data is available there as well. So that's it from me, and I will pass it off to Steve.
Great, thanks, Roxana. Hope everybody can hear me okay. So what did we do? So before COVID hit, IPA was pretty active, as we usually are at any given time. We have about 200, 250 active field studies, mostly randomized controlled trials, over a fairly large footprint of 22 country offices throughout Africa, Asia, and Latin America. And most of that data collection is face-to-face. So in mid-March, we, like most of you, started the great pivot of 2020 and shifted to remote survey methods. Now, we explored IVR and SMS, but most of the 60 surveys that we launched in the first few months were CADI, so live interview phone surveys. So and those were a mix of random digit dial surveys, surveys that were follow-ups from in-person baselines or other ways of recontacting lists that we previously had. So this came at a time when we already had a research methods initiative that I lead from IPA, but in collaboration with Northwestern University's Global Poverty Research Lab. And this really provided an opportunity to accelerate a lot of that learning about things like interviewer effects and data reliability, data quality, determinants of data quality, and so on. So we tried to make sure, especially given the novelty of phone surveying for many of the researchers that we work with who are used to face-to-face, to learn as many lessons as we could about how to do this effectively. I had been doing my previous position a lot of phone surveying in the US, but it's very different. Much of what we know from published literature comes from the US and Europe and from a different era, which is not as applicable to low and middle income countries. So there's a real need, I think, to address those issues. And the challenges that we faced were the challenges that probably many of you have faced with lockdowns. Distributing devices to interviewers, standing up virtual phone banks requires remote training and supervision. So we learned a lot about effective methods for doing both of those. Heavy reliance on audio audits as opposed to back checks. And dealing with reduced connectivity and bandwidth and personal privacy for interviewers as well as respondents. So we had to adapt questionnaires to find ways to detect whether somebody really is able to talk in a quiet place, but particularly if there are sensitive questions being asked. A lot of the researchers that we work with were not familiar with remote survey methods. And so there was some work involved in, like Roxana said, you can't just take your 3-hour sit-down interview and just write a script with it. You really have to adapt and think about how questions sound over the phone and different ways of establishing rapport with respondents. And it's a very different kind of relationship and different kinds of skills and training for your enumerators. So if you are training enumerators for phone interviewing who are used to going face-to-face, you have to prepare them that you could have a lifetime of rejection in one afternoon of dialing, particularly in RDD surveys. You have to, if there are any open-ended questions, particularly in this time of pandemic, you have to have vicarious trauma training so that people can be prepared for what they're going to undergo, especially when they're doing this virtually and they don't have a colleague they can turn to for emotional support, because there are real demands on your capacity. So we had the same concerns that probably many of you have about response rates, coverage bias, and constructs that are hard to measure. Things like, we're measuring cognitive skills of 4- and 5-year-olds over the phone, right? That's hard enough to do in person. And so what are we learning? What are some of the best practices? Well, unfortunately, much of what we're learning very systematically, because we're building in experiments, we're collecting paradata, and you can learn a lot from observational data, is all being summarized, and we're planning to report this out over the coming months. So I can only give you a taste right now, just a sense of what can be learned. But I'll just say that you can learn a lot just by collecting basic paradata, which is data about the data collection process itself, and looking at observational statistics. So I'm going to just quickly share a graph that shows, for example, when you just, I don't know if you can see it now, is my screen visible? Just looking at response rates, or looking at, in this case, percentages of respondents to a random digit dial survey who are women. There's a lot of policy interest in the effect of COVID-19, specifically on women and women's issues. And if you random digit dial, especially in Africa, you're going to have a hard time reaching them, right? Because maybe men are more likely to own phones or pick them up. And so you can see that you're going to get less than half of your respondents being women, significantly less in some countries, although surprisingly more in others, and that there is variation. So this national context matters. So just looking at these kinds of statistics really illuminates quite a bit, and gives insights into how to design future studies. And similarly, we can run experiments, and simple things like randomizing who gets an SMS pre-survey to determine if that affects response rates. And what we found in one country, for example, that we actually get an improvement in response rates by 2 or 3 points from sending SMS ahead of time, but it doesn't come from getting people to answer the phone. It's from getting them to establishing legitimacy of the call, of the interview. You can see all of it happening in that first stage of making it through the intro screen, the intro script. And it doesn't really change as we go through the others, and this is, I sort of want to end with one finding that really went against my intuition, because we're finding it's at this point it's sort of anecdata, but over and over I've been finding that we're not getting breakoffs, right? Even with our longer surveys, and this is counter to all of my intuition. People are staying on the phone. So it's hard to get them on the phone. It's hard to get respondents to just get through the first minute of a script. But once they're listening, we've gotten very high cooperation rates, even for longer surveys. And this may change some of the traditional advice that we've been giving about how long a caddy survey can be. And it doesn't matter, by the way, the type of message. We varied at least within what we varied so far. We're trying other experiments. But you can vary the content of the message and not find a difference. It's just whether you send an SMS. In this case, for these countries, and we've got 6 other countries in the same study that were going through the same data, and over the coming months, we'll have months worth, several, like a dozen countries contributing to this question and others like it. And it's not that hard. So I would actually encourage people to study yourself as you're doing this, and there's a lot to be learned, and it's really helpful for designing more efficient studies in the future. So with that, I'm looking forward to your questions, but I will pass it on to Abba.
Thanks, Steve, and for the study I'm going to talk about, we were following up to a face-to-face survey, and we also had to really train our interviewers who had done the face-to-face survey that they would face, as you said, a lifetime of rejection. So that really resonated. So as Charles said, I work for ICAP at Columbia University, and we were given funding from CDC to create estimates of people who have COVID-like symptoms in Lesotho. So to do this, we created a phone-based surveillance system based off of a face-to-face survey, FIA, that was in the field between December 2019 and March 2020, during which the program interviewed 13,000 people. So though I had done phone surveys before, I wasn't really sure what to expect and how many people to call to arrive at our desired sample size of about 1,700 people. So let me share in broad strokes how many people we called and what the outcomes were. So we called 3,020 people to end up with about 1,800 people in our sample size. So that ended up about 60% of people who we called enrolled. And I actually thought it was going to be a little bit higher than that based on my previous experience. So in Burkina Faso a few years ago, we called back women who had participated in a face-to-face survey, who had given us their phone numbers a year ago, and we also had about a 60% enrollment rate. And I thought in Lesotho, where phone ownership is higher, we were calling both men and women, and we were calling back phone numbers that had been given to us more recently. I thought the enrollment rate would be higher, but in fact, it was about the same. So just quickly, about a quarter of people we called were subscriber unavailable, meaning the phone was off or they were out of network. Only 4% of phone numbers were out of service, meaning that the phone number was no longer valid. Very low refusals, as Steve said, all refusals happened pretty quickly in the first minute or so, only about 3%, and the remaining 10% were ineligible for a mix of reasons. So this brings me to one of the best practices I wanted to share. Having really thinking through the call outcomes that your interviewers mark at the end of the call will give you good data about who's in your sample and why not. So we had about 6 outcomes that the interviewers would mark, and then there'd be a follow-up question about, so if the phone call was not picked up, why was it not picked up? Was it out of service or et cetera? So that was really helpful information to get from the interviewers. So we launched enrollment on July 1st, and we took 2 weeks to call these approximately 3,000 people. We have 16 interviewers who work 20 hours a week, and that translates to 5 4-hour shifts. We're now calling participants weekly for the next year. Yes, I did say weekly for the next year, which I am nervous and excited about. So I'm not sure what to expect, but I will say our week 1 and week 2 response rates were exciting and high, 91 and 92% respectively, and only about 40 people between week 1 and week 2 didn't answer both weeks. So I think response rates are high for a few reasons. One, FIA, the survey, the face-to-face survey is well known. It's our second time in Lesotho. We draw blood for HIV testing. We return HIV results. And for those who are HIV positive, if they want, we link them to care. So we have quite an on-the-ground presence. And so the salient event that respondents can recall and establish legitimacy quickly at the beginning of the call when you're trying to center the person you're calling as to who you are, how you have their phone number, and the fact that FIA was a well done and notable survey helps. Another reason I think that our response rates have been good so far are that the respondents are a wealth of COVID information, that interviewers are a wealth of COVID information for the respondents. So we use Slack to communicate with interviewers, and we have a channel dedicated to COVID, and we have updates on the number of daily counts and deaths in Lesotho. And I think participants, the respondents really like to have that information. We also answer questions about transmission that are posted on Slack that the interviewers can then take back to respondents. We also give an incentive that of course can help response rates. We tried to give it the day after enrollment so that respondents knew that we were true to our word, and I will say it is lockdown in Lesotho, so I think having people at home helps your response rates. So just a lesson learned before I wrap up. We did, during enrollment, collect a backup phone number. We kept collected the phone number of a household member and permission to call that household member if we couldn't get a hold of the respondent themselves. And we found a lot of cooperation from the participants, but we didn't leave a question in the weekly surveillance questionnaire to have a phone number updated. And we're finding that actually respondents want to give us a different phone number if for some reason the one that was on file is not available. So we now have a system to enter that new phone number, but I wish we would have had that from the get-go. Also, the name of the respondent was, collected during the face-to-face survey. Sometimes it's not exactly right, and we didn't have a system for interviewers to report back the correct name. And when you're calling somebody back for a year, it's better to use the correct name. So we now have a system, but I wish from the get-go during enrollment we would have had a question where the interviewer had to confirm the participant's name. So now I'm very excited to see what our attrition rate is over the next year and response rates and our first estimate of flu-like symptoms. So that is fever, cough, and shortness of breath are going to the Ministry of Health on Friday, and we'll send them weekly updates thereafter. So I'm passing to Kristen.
Thank you very much. I'm Kristen Himmelin. As the introduction said, I'm a senior economist and statistician at the World Bank. I wear a couple of hats for that organization. I'm the team leader for small island states in the Pacific, and I'm the co-lead on our global solutions group on welfare measurement and data innovation. I've been with the bank for about 13 years, and I spent my early career as a sampler in our living standards measurement study, which is kind of our survey methods research unit. The reason that I am the co-lead for the World Bank's high frequency global monitoring is because I was the team leader for the great granddaddy of these at the World Bank. Many people here have been doing phone surveys for a long time. The World Bank is probably not usually at the forefront of innovation, but I remember in 2014 walking into my boss's office and saying, I want to do a phone survey about Ebola in Liberia, and the man looking at me like I had horns. So I've been doing these for a while. It's been really interesting to see the evolution of this process, both kind of in the wider literature and also within the World Bank itself. So let me talk a little bit about the initiative we have now. We have high frequency mobile phone surveys that are either planned or in the field or with multiple rounds of data collection finished in over 100 countries. As I only have 6 minutes, I'm not going to name all 100 countries, but I'll tell you where we don't have surveys. So my apologies to Armenia, Belarus, Belize, Eritrea, Guyana, Iran, Montenegro, Panama, Serbia, Suriname, Timor-Leste, Turkmenistan, Ukraine, and Uruguay. So as you can see, those are the countries that we're not working in. The countries that we are working in is everybody else. So there's a wide range of different places that we're working. And this, our initiative is very decentralized. It's very different from one country to the next. Kind of commonalities across our work, nearly all the surveys are CADI. Most are conducted from remote call centers. This is both, out of the constraints of national lockdown laws and also at kind of the natural abundance of caution. Our sample sizes are about 2,500. So, they vary a little bit, somewhere between 1,000 and 5,000, but 2,500 is mostly who we're targeting. They're panel surveys, so we call people back monthly, and most are planned to run between 6 and 12 months, which is hopefully the duration of the crisis. The target length is about 15 minutes. We have, again, variety from country to country. Our response rates are, again, highly varied. We have some countries where we're looking at response rates in the 20s. I will highlight Poland as not being that country. In Poland, we have very high response rates. In addition to that, people call the grievance number and ask when the next survey will be and start giving the government unsolicited advice about what they should do. So some countries are the population's very eager to give information. Other countries, it's a little bit more of a challenge to convince people to participate. We have a huge variety of partners. In some countries, these are administered by the National Statistics Office itself. We've partnered with telecoms to just run straight off subscriber rolls, and we have formal survey firms. So again, we have a lot of variation in what we're working on. Overall, the surveys focus on economic issues. We are, after all, the World Bank. So we focus on job loss, income loss, depletion of productive assets, as well as kind of longer term human capital loss, avoidance of the healthcare system that may lead to long-term health crisis, or children being out of school that could impact long-term educational attainment. because it is so decentralized, I could kind of talk a little bit about each project, but sort of going global and talking about some of the bigger picture messages that we have. Our respondents pretty much across the board skew toward the top of the welfare distribution. We tend, as the literature probably suggests, we get more urban respondents. We, in many countries, get more male respondents, and we tend to have higher levels of education. Sometimes the skew is very, very hard. One of the countries that I'm working on personally is the Solomon Islands, and our first round of data collection, I recreated the deciles from the DHS because we had asked all the questions that is used to put together the DHS Wealth Index. I recreated the deciles, and 85% of my respondents are in the top 3 deciles. So this is a situation that it's grim to, do what I can actually say about, the populations we're interested in is very limited. So this kind of brings us to the first kind of major lesson learned for us is that, when we think about re-rating, we think about usually re-rating on demographic variables or location, urban, rural. It's not enough. We found that, we can make all of those things line up and still be heavily skewed toward the top of the distribution. And sometimes actually that re-rating makes the situation worse because we're weighting up like these very rare parts of certain groups. So a major thing for us is how to collect a welfare measure. In certain places, we're going back to respondents that have already interviewed in face-to-face surveys, and there we usually have a welfare measure, be it income or consumption. In places that we aren't doing recontact, we are doing, kind of machine learning techniques to build models, parsimonious models that we can ask maybe 10 or 15 questions and proxy that. The example I gave of the Solomon Islands, we were using the DHS, so we take the questions out of the DHS and ask them. In all cases, it's not ideal because, we only have 15 minutes, and to re-ask the DHS, it takes 6. So you sacrifice a lot of real estate in your survey to be able to do this. But as I said, it's so crucial to the type of work we do that we're able to really understand who our respondents are. Beyond that, I think, on the policy side, I think one of the most important lessons is actually comes from the Ebola work. In the beginning, so we ran these surveys all the way through. We had 5 rounds in Liberia and 4 rounds in Sierra Leone. And in the early rounds, when they're at the height of the crisis, I had the World Bank's president's office calling me, which is unheard of. I had media outlets cold calling me. I had all of these people burning for information. But when you kind of got to the actual data, it's like, well, sir, I can say the situation in Sierra Leone is dire, with somewhere ranging in a confidence interval to distressing to atrocious. There's not too much you can say. Things were bad. And I was able to put numbers on how bad things were, but I wasn't really adding any insights. Where we found the most kind of relevance for our policy work is later. So in our recovery surveys, in the recovery period, after, maybe I'm not getting quite so many calls, I guess, for example, in Liberia, one of the things we found is that you can control for everything under the sun. Women small traders weren't recovering as fast. Men small traders were working again. They were earning income again. Women in wage employment were earning again. But these women who are small market traders had consumed their productive capital as a coping strategy and were having trouble getting started. And if you think about what they need to restart, it's a few dollars. So you can design a program specifically targeted to these women that helps them just restart that. And that's, I think one of the really powerful things, to be able to collect this data, identify a group that's been overlooked that wouldn't receive this otherwise, and then be able to design an intervention to address their needs. And so I think that, that's probably one of the more rewarding things that we get out of the whole experience. So with that, thank you very much, and I will pass to Shane.
Okay, great, Kristen. Thank you very much. I am from UNICEF, and I will be discussing some of the work that we've been doing on a mobile phone survey that is representative. And we basically used a household survey where we were doing some pilot testing. And we based that as our sampling frame to collect phone numbers and call respondents over 11 months. So we've been doing this for 11 months. We've concluded, and the results are now on our website. It was a small study in 2 districts of Belize, so one of the countries that Kristen and the World Bank isn't covering. And of course, we're calling the same households every month, so this is a panel survey. Now, because of the nature of the work and the indicators that UNICEF is interested in, typically we do want to talk to people because there's fairly detailed kind of information that we would like to get. And we included questions such as education, time use, how children spend their time, child labor, child discipline. And in between all of this, COVID-19 hit, and that was an amazing opportunity for us to really test and see how well our method can be used to change very quickly and pivot in terms of the questionnaire contents and delivery, and how quickly we can get results out about COVID-19. And we also experimentally tested what respondents would be best for this type of phone survey. Typically in mixed surveys, we try to get mothers or caregivers of children to answer specific questions about their own children, because they really do have that detailed level of knowledge about children. So we experimentally tested this over 11 months, looking at different response rates and seeing how that actually varied. And we saw a number of really unique things with these data. We see really massive declines in educational participation, children obviously spending very little time on the studies while they were at home. And we saw delayed upticks in violence against children. So initially when the pandemic hit, violence against children, such as violent punishment in the home, was actually on the decline. But then we saw an uptick towards the later months after kids had stayed home for a number of months, a month or two, we started seeing increases. And we also saw increases in child labor, especially in one somewhat impoverished district within Belize. In terms of methodological and operational challenges, I think one of the things that working essentially under emergency conditions taught us was agreeing on the content of the questionnaire wasn't necessarily the easiest thing to do, simply because we were dealing with a new disease that no one had particularly understood. We had very little ideas about how the disease actually works, what the epidemiology is, and so coming up with social constructs around that was somewhat difficult. However, we chose a more pragmatic approach that the government of Belize and UNICEF could use in joint programming to address some of these concerns. So we initially started asking about, have you heard about COVID-19? And needless to say, just everyone did in our sample. And we asked about how people protect themselves from COVID-19. And we do see really interesting changes over time, and especially those were linked, I think, to some of the government recommendations that were coming out in Belize. And of course, we asked issues related to public support for some of the kinds of lockdowns and mitigation strategies the government had put in place. Operationally, we started this survey in a research center that we had set up with the government of Belize, and interviewers went in on a daily basis and made phone calls from the research center, and suddenly we had to pivot and move all of this to an online platform, it's already online, but all the interviewers suddenly had to be within where they had phone service. And so we suddenly had to think of new ways of constantly engaging with our interviewers and making sure that they were doing the optimum level of work that is required to actually get this the survey done. And finally, one of the operational challenges that we did have, also methodological, was we did have some issues in finding households that split off. So if we went to a household first and we called that household and the household split into two, household members left, husband got thrown out of the house, someone might want to give us necessarily contact information for that household. So that has implications both on our sampling and our sample weights, which we had to account for. But luckily for us, in this case, we didn't have too much of that occurring. In terms of best practices, I think one of the things that we really begun to learn and embrace at Mix and UNICEF is automation, and the fact that automation of certain processes that we do within surveys, especially mixed surveys and now Mix Plus, can really save us time and save us effort and free us up to do other things. So part of what we are doing is automation of sample weights, automation of data sets to create online dashboards. So all of these things are going to be more or less a seamless process moving forward based on our current experience. And finally, I want to say that having success in an emergency and working like this does need a great deal of flexibility in terms of your thinking, and in terms of thinking, especially as it relates to process and outcomes, and thinking very broadly about how can you better position the resources that you have to make sure you have a product that is shippable and useful for different parts of the house. And I'm talking about the government of Belize and UNICEF and other people who rely on these data. So with that, I'll pass back to Charles.
Thank you, presenters, for sharing your best practices and experiences. And also thank you to the attendees for providing your questions in the Q&A. We'll try to get to as many as we can in the time we have remaining. I'll group them to the extent possible based on themes. So there are a few questions on the sampling, and I think, Kristen, I might direct the first one to you. There are a few questions around what are the sources of sample for mobile phone surveys, and I know the World Bank has looked at both recontacts of previous face-to-face survey respondents on one hand, with a random digit dial on the other hand. If you could kind of talk about some trade-offs in those two methods, that would be useful.
Absolutely. So as Charles said, we do have two main methods for drawing samples. The first one is to recontact participants in a previous survey. And the benefit there is you already have hundreds of questions from this 3-hour monster survey that you could use. And you can use that for analysis. You can use that to measure trends over time. You can use that as part of your reweighting calculations. You just have this wealth of information that you can draw from. Sort of the downsides of that is, along with importing all of this great information, you import the survey design. So you import the cluster effects, you import the stratification. So you import a little bit of this, loss and inefficiency from clustered sampling that is not necessarily necessary in mobile phone surveys, right? The reason we cluster surveys is because of cost, where if you're making phone calls, there's no difference in calling people within the same village or within, or scattered across the entire province. So that's one of the drawbacks, is you bring in this inefficiency from sampling. The other one is your sample size is capped. If that original survey has 2,500 respondents and you have a 60% response rate, that's it. You can't create more sample. On the other side, we have random digit dialing, and there, you don't have much information. It depends on the source of your numbers. Sometimes telecom companies can give you gender or location, but you basically don't have much information. But you can call as many as you want. You can get whatever sample size you want. And kind of the other drawback there is that it's representative of the population of mobile phone subscribers, which, if it lines up with your total population, is great. In many countries, it doesn't. And then you need to sort of think about a lot about how you're going to do the reweighting. Thank you.
Thanks, Kristen. There's a question for longitudinal CADI surveys like Recover. This is from Samira Zaidi. Are respondents being, I guess this is to Steve, are respondents being replaced if the attrition is high? And how do you deal with replacements? So I'd ask Steve maybe to start, and then Abba, if you want to chime in too about your experience with your study, that would be great.
Yeah, no, it's a good question. Recover is a survey on that IPA is conducting on responses and impacts of COVID-19 in currently 10 countries, and we're just starting wave 2. So our plan currently is not to replace attriters. That's the short answer. There's all sorts of reasons why you might want to do replacement or not, but that's our approach.
Ours as well at this point. I will say for participants who were no longer in the household where the survey took place, we're calling them monthly to see if they've come back to the household because we think those people might be high risk for COVID-19. So we have a little bit of a flexible sample with people coming in, but we hope we won't have to replace.
There's another question around about how panelists would use mobile phone surveys to reach members of the informal economy, such as informal waste collectors. I would broaden that too to connect to what Kristen was talking about, the difficulties of reaching people at the lower end of the welfare spectrum. So I'm wondering, Shane, if I could address this to you. In your Mix Plus survey in Belize and other work that you're doing, how do you think about non-response issues for people at the lower end of the welfare spectrum, and how do you deal with that when you interpret the results?
In a sense, we didn't necessarily have that issue because we started off with pretty much a representative sample of the population to begin with, and from that sample we had very good response rates. So we did a 100% sample of those. So we took everyone from that baseline survey, and we used it to call over the next couple of months. But I think what's probably going to be more applicable is some of our experience going forward in the new Mix Plus surveys, which will be nationally representative in Mongolia, Georgia, and a number of other countries coming on stream. We will actually start thinking about using replacements, and we will set up those replacement households from even before we start the survey. So we will have those in reserve that we can use later on.
Thanks, Shane. And Kristen, I know you mentioned difficulties reaching some segments of the population. How does that work, especially for policy recommendations where decision makers these are the populations that policymakers want to assist the most?
Yes, and we do a lot of the same techniques that Shane mentioned, but also one of the things that we've increasingly done for these rare populations, such as informal waste collectors, is combine probability and non-probability designs. So informal waste collectors are a very small portion of the total population, so you're unlikely to get a lot of them just using random digit dialing. But you could do a targeted collection of numbers, right? So you could either go out and physically collect them, you could draw them from a database, you could draw them from an outreach center. This usually applies to us with certain ethnicities. If we have an ethnicity that we believe might be excluded, we try to combine these probability and non-probability methods so that we have enough sample to make policy recommendations for these rare groups. Thank you.
Thanks, Kristen. And maybe to Roxanne, on the same question on the sample, can you talk about Geopol's method for sampling, and because I think it's an interesting and unique approach?
Yeah, we use a few different methods. So we partner with mobile network operators in a lot of the countries we work in, although as we're doing more CADI surveys, we also use RDD. So our sample frame is often mobile subscribers. In each country, we usually are connected to multiple of the mobile networks operators, and that's how we get our sample frame. For the informal economy question as well, it was actually quite interesting for the study that we did because we wanted to make sure we could compare formal versus informal workers since we were looking at the economic impacts. And we actually did get 50% of our respondents were in that informal category, even using SMS. And also a majority were in the lowest income bracket that we had given, which it ranged depending on country, but about up to about $200 USD per month. And that was using SMS. Of course, we do see the skews with education as well, similarly to what other panelists have said, but it was quite interesting that we actually are able to reach farmers, smallholder farmers, cleaners, beauty services, even using mobile phones.
Great. So moving on to questions around data collection and questionnaire design, I think there one might be to Abba about how many times will you call a unique number? And how do you think about that? How do you measure what the ideal number of contact attempts is? So maybe that's one question. And then the next question for Steve would be about you mentioned the duration of mobile phone surveys, and you were initially thinking, had one assumption, but you realized that the break-offs are actually quite low. So what advice, Steve, would you give other practitioners on this webinar about how to think about the questionnaire length for mobile surveys? But first to Abba on the contact attempts.
Yeah, we found that up to 4 calls, you'll yield new people responding, but we found in Lesotho so far, most of the people that pick up have picked up on the first call. So that's where we've gotten the majority of our sample. And because our interviewers were well trained to categorize the outcome of each call, we were able to pull, like, for example, the number out of service, the numbers that were no longer valid out of the list, so they were not recalled. So I haven't found a lot of examples of 7, 8, 9 calls yielding new people and or people who are different from those who first responded. So we've kept it a lower number of contacts, and we haven't analyzed that yet for our Lesotho study.
Yeah. So actually, that question interests us as well. The same. I know you posed a different question to me, Charles, but on RDD surveys, we've dramatically reduced the number of call attempts over time as we've realized that, yeah, you get your successful calls after 1 or 2. Otherwise, you're sort of wasting a lot of time. So it's much less efficient, especially if you're trying to meet a quota. Now, you have to recognize that the success rate diminishes really rapidly with multiple attempts. But we're still doing more research in some of our countries on whether, on the quality, right? Are you getting better representation if you put in all that extra effort? And so it's a little bit harder trade-off to measure. If for purely quota numbers, call once or twice on an RDD, max. But if you're going for, quality sample, you may have to work harder, and that requires a lot of attempts and attempts at different times and spacing. The question you asked me was about
questionnaire length. That's a question like I get all the time in RTI. How long should my questionnaire be? What would you mention to the audience about how to think about that for studies?
So the standard advice was for CADI, keep it to 15 to 20 minutes. A lot of this, I think, based on a lot of collective wisdom. I know in my career that's been built up over working with like parents and teachers in the US. And I would say the jury's out. There may be opportunities to do longer surveys. We're still not sure if this is a COVID thing or if, with the current conditions and people having more available time or interest in the survey content. We're still exploring not just the breakoffs, but data quality and fatigue effects, both respondent fatigue and surveyor fatigue effects, by looking at the sort of attentiveness gradient over the duration of a survey to figure out where those inflection points are. At what point do the quality of responses start to fall off? And that, I don't have an answer now, but we're studying it closely.
Mm-hmm.
Charles, I have something to add to that one.
Please.
I mean, question length is one thing, but what I've also found from our experience is that the subject matter really does help the interviews or not. In Belize, for example, no one ever wanted to talk about water and sanitation and hygiene, but everybody wanted to have an opinion about disciplining children and issues like that in the home. So I think depending on the subject matter, I think your response and the amount of time that people are willing to have with you on the telephone is going to be quite different depending on the saliency to their lives.
Right. Thanks, Shane. Great point. To Abba, there are a few questions around confidentiality and ethics, and one question to you is, how do you deal with confidentiality issues, especially with women in rural communities who may not feel comfortable providing certain information? I know from your experience at ICAP, but also at PMA and other contexts, what kind of recommendations would you give the webinar attendees about confidentiality and protecting the safety and privacy of the mobile phone survey respondents?
Sure, I think that's a great question. I think the first step is training your interviewers, not only to understand confidentiality as you would do for any survey, but what to pick up on if someone is uncomfortable. I've never fielded a hypersensitive survey, so I can't speak in depth about that, but we've made sure that our interviewers know what cues to pick up on, which is like background noise or just any hesitation. We do abbreviated verbal consent for our study, so we have the general information available, but it's rapid. You can't go into a full consent on the phone. And this is the downside of mobile. You don't know where the person is. They could be at home, they could be at the market. And so you have to trust a little bit that the respondent is able to, in our situation, we've not had sensitive enough questions to worry too much about it. I would say finally that we've put in effort. I think someone mentioned like I think it was Kristen, a grievance line, and I'd love to hear more about that eventually because we don't have that, but we do have other ways to stay in touch.
Great, thank you, Abba. So we're running up to our time limit, but I was hoping to go in order of the presenters, the 5 presenters, the same order we started in. What is sort of one silver lining you take away from this COVID experience? Something that you remember, 5 years from now about this time as a researcher doing these surveys? So starting with Roxana.
Yeah, I think it's been really interesting to go back to what you were talking about at the beginning, Charles, to just see the uptake of mobile surveys. At Geopol, we've been doing this for 8 years, and we, like Kristen said, we did a lot of work around Ebola, but then it sort of shifted back to face after that, and COVID is so global, it's likely to go on for a long time. So I think there's a really big opportunity for us to do these types of studies, to see what modes work, what are the disadvantages, advantages, and really have it become a more mainstream method, because we found at Geopol, we've really been sort of the scrappy underdog in terms of methodologies. So it's exciting to see so many more researchers doing projects on this and doing more research on this. So I would say, for the research community, I think it's sort of forcing us to get to that place, but I think that is in the long term beneficial.
Yeah, I would say something pretty similar, which is that, when we look back on the great pivot of 2020, we're going to recognize that as the turning point when we became much more nuanced and developed a much deeper toolbox, such that I think future studies in low and middle income countries are more likely to be multi-mode, where they would have been just face-to-face, and they're going to be more efficient. And I think we're going to get better. We will have gotten better quickly at designing more efficient surveys and mixing them, particularly we're going to go back into the field, but mixing in an intelligent way, the kinds of, in-person baseline with high frequency SMS, for certain, measuring time use or dietary intake, and then, matching the methods to the need and doing so efficiently. And that's really exciting. The acceleration of this understanding is what we're going to look back on.
Yeah, echoing Roxana and Steve, it is incredible to see all the work that is being done and the nuance that's being created. Specifically what I'll remember from this time is waking up at 6 a.m. for a week and joining a remote training and just thinking I don't know how this is going to go. I don't know what the results are going to be like, not knowing, I'm used to knowing the colleagues better that I'm working with. So it really felt like a leap of faith, and that was hard, but it seems like things so far are going well.
From my side, I think, it's been striking from 2014 to now. It's only been 6 years, but in 2014, there was basically no appetite for this. It was something that I'm like, I think I can do this. And I pushed the agenda, raised the money, and made it happen within the World Bank. And I, as now six years later, which is a heartbeat, we have over 100 of these. So recognizing how important these are and how useful they can be in informing both immediate and long-term response. I think that's, actually, I had sort of suspected that was happening, but to see it that clearly manifested has been really heartening.
I think from my side, there are a couple of things that came out. One is that, for me at least, phone surveys would possibly be used as a way to inform other kinds of survey activities or to supplement and to frankly even take some of the burden off of very large household surveys, if we do know that phone surveys can reliably collect some of the data that we do need. And I also think that going through this process, which is a very rapid process and an intensive process, it will push us as a field to go more into automation and also to use alternative data sources, which will help us inform the various kinds of problems that we have with good quality data.
Well, thank you to our speakers, participants, and webinar team. It's been a really fantastic hour. So thank you for sharing your wisdom. And I know there's so much out there in the field by everyone who's working on these studies. So we look forward to learning and best practices together and getting together another time to share them and to all learn together. So thank you for attending the webinar. It's been a great time, and we'll be in touch.